we're concerned about Zika virus, sort of panic, or the populace now is more concerned about Zika virus because that's in the news than Lyme disease. First of all, it depends on where you are. If you're in Florida, for instance, I don't know if they even see Lyme disease in Florida. If they do, it's very rare, whereas Zika virus seems to be increasing. If we're in New Jersey, we have yet to see a case of Zika virus that hasn't been imported from somewhere else. Our mosquitoes are capable. We have mosquitoes in New Jersey that are capable of transmitting it, but we don't seem to have it as an epidemic here yet. And it's not likely to happen, in my opinion, because we have something here called winter. And so that kind of stops the spread. So we have people coming here. The only way to get Zika virus up here is if you had enough people infected with it who came to this area while they were actively infected, got bitten by mosquitoes, and the mosquitoes are now infected and spread it. Mosquitoes are not active for several months of the year, so that kind of puts a lid on these mosquito-borne diseases, which is why we don't see a lot of mosquito-borne diseases in the Northeast. Even like West Nile virus, which got a lot of play. I mean, when it really came down to it, we saw very few cases of West Nile virus. We still do in the Northeast, because the birds are spreading it, so there's more chance of it spreading. But I guess I'm getting off topic. As far as Lyme disease is endemic in this area. If you live in North Jersey, if you live in Long Island or the islands off Long Island, if you live in New England, you are at risk of developing Lyme disease if you go outside into the vegetation, which doesn't mean you have to go hiking in the woods. You can be in your own garden, in your backyard. So Lyme disease is a much greater risk of catching it in this area. As far as damaging, as it being a damaging illness, Zika virus on the short term, unless one is pregnant, doesn't seem to have a lot of tendency at this point to cause serious problems. There are some people who get Guillain-Barré syndrome with it or other things, but for the most part, most people don't get terribly disabled from it, whereas Lyme disease, if it's not diagnosed, most people won't get terribly disabled. Most people get over it and don't even know they have it, but there are people who will get a long-term illness, and if it's not diagnosed, they could be ill for a long time. I think at this point, I think maybe 10, 15, 20 years ago, that was more of a problem. I think there's a lot of Lyme awareness in this part of the country anyway. Again, other parts of the country where they don't see so much Lyme disease, I'm not sure. I spoke, for instance, to a physician in California once who was seeing somebody who came from New Jersey and, was a patient in our area, and she says, well, we don't see Lyme disease here, so you want to tell me about it? But I thought of some illness they have out on the West Coast that we don't have here. And I said, well, okay, just like everybody who comes in your office probably has that particular illness, everybody who comes in an office here has Lyme disease. So yeah, I mean, the clinician needs to be aware of Lyme disease and somebody who comes in ill. Patients need to be aware of, but I think most people are. In fact, more often than not, when I see somebody who's ill, it's more the case of I have to convince them they don't have Lyme disease. And if they come in, unless they come in with a definite diagnosis right away, and even when they do have a definite diagnosis, many of them will say, but could I have Lyme disease? And I'll tell them, look, if you have Lyme disease, I can't say you don't have Lyme disease, but that's not explain what everything else is going on here. So.